What emerging imaging techniques are used with mammography? Imagine a future where detecting breast cancer becomes even more precise and early. That's what emerging imaging techniques aim to do alongside traditional mammography. These new methods help find cancers sooner, especially in women with dense breast tissue or those at higher risk. They work by providing additional details or functional information about the breast tissue, making detection more accurate. One of the most promising advancements is digital breast tomosynthesis, often called three-dimensional mammography. Instead of just flat images, it takes multiple X-ray pictures from different angles to create a detailed 3D view of the breast. This helps reduce the overlap of tissue that can hide small tumors and lowers false alarms. It's especially helpful for women with dense breasts, where traditional mammograms might miss cancers. Contrast-enhanced mammography is another exciting development. It involves injecting a special iodine-based contrast agent before taking the images. The contrast highlights areas with increased blood flow, which often indicates tumor activity. Studies show that contrast-enhanced mammography can detect more invasive cancers than standard mammograms, particularly in dense tissue, and it can help reduce false positives. Molecular breast imaging uses tiny radioactive tracers to detect metabolic activity in the breast tissue. Cancer cells tend to be more active metabolically, so this technique can find cancers that might not be visible on regular mammograms. When combined with tomosynthesis, molecular breast imaging shows great potential for improving detection of invasive cancers. Contrast-enhanced ultrasound is another tool that uses injected contrast agents during ultrasound scans. It helps visualize blood flow and tiny vessels within suspicious areas. This functional information can improve the accuracy of diagnosis when used alongside mammography, especially for ambiguous cases. Photoacoustic imaging is an emerging technology that combines laser light and ultrasound to visualize blood vessels and oxygen levels in breast tissue. It can detect changes related to tumor growth earlier and more precisely by highlighting abnormal vascular patterns associated with cancer. Artificial intelligence is increasingly being integrated into breast imaging. Advanced algorithms analyze images to detect subtle patterns that might be missed by the human. AI can help predict cancer risk, reduce false alarms, and tailor screening strategies to each individual, making the process more personalized. While magnetic resonance imaging is not used directly with mammography, high-resolution contrast-enhanced MRI scans are valuable, especially for women at high risk or when mammogram results are unclear. Newer MRI machines offer faster scans with better detection capabilities and fewer false positives. In clinical practice, these emerging techniques are often combined with traditional mammography to create a more comprehensive screening approach. They are particularly useful for women with dense breasts or elevated risk factors, where standard mammograms might miss early signs of cancer. It's important to remember that these advanced tools are used alongside, not instead of, regular mammography. Patients should always discuss with their healthcare providers which imaging options are best suited to their individual risk factors and breast health. As research continues, these innovations hold great promise for catching breast cancer earlier and improving outcomes for women everywhere.